An RIT professor returned from Liberia 2 months before the Ebola outbreak hit. He was there to perform a healthcare assessment. 13 WHAM's Rachel Glazer is here now to tell us just what he saw in Liberia. Rachel?
Well, Jenny, he saw a country unable to cope with basic medical needs. That in itself was a shock, so he can't imagine how it can treat the demand from a virus as contagious and deadly as Ebola. 2 months before the outbreak, John Oliphant toured the health clinics and hospitals in Liberia. He says the conditions there are worse than most can even imagine.
So you just use these tools and then the next patient comes in and you use the tools again?
Yeah, it's true.
From surgical instruments to sheets, just about everything was unwashed and reused, patient after patient.
I went and visited this one clinic that only had one pair of rubber gloves that the whole staff needed to share.
It's no surprise the deadly virus spread so quickly. The basic medical supplies needed to contain anything contagious aren't available.
And now they all started getting sick.
You'll have someone resting.
There are only 1,200 people licensed to practice medicine in Liberia, and so far 170 have died.
Every couple days I'll hear about another physician assistant who's passed away, or another doctor, another nurse, and it's really terrifying.
Without the equipment to protect themselves, physicians are becoming patients, and Oliphant's friends are dying.
It's awful. He's even said, like, it's really hard to even think about continuing to go to work because everyone's afraid they're going to get sick and die.
Too sick or too scared to do anything, Oliphant says it won't be long before the entire country collapses.
It's just kind of like mass despair. Nobody's working, nobody has money, nobody has access to food, everybody's kind of isolated and scared.
He says it'll take a huge international response to stop the spread of Ebola and save the people in West Africa.
They would just, eventually die. Like the disease is spreading so exponentially, and they have so few ways to protect themselves that it would just be a disaster beyond anything anybody's ever seen, I think.
John says if Ebola is not stopped at the source, it will continue to spread and keep killing people. So he said what started as Liberia's problem is now everyone's problem, and he hopes other countries follow the U.S.'s lead and step in to help. In the newsroom, I'm Rachel Glazer.